you, Nate. And a second by Betty. Are there any corrections? I believe we do have one correction.
I am showed in attendance, but I was not.
Okay, so Miss Daly was not in attendance. Okay, any others? Okay, so with that addition, all those in favor, please state aye. Aye. Opposed? Okay. Next, we're on to our informational items, and the first is the Board of Health and the Health and Human Services campus update.
Mr. Chairman, do you want to do that, or do you want to take the chairman's privilege and run through the other items on the agenda and come back to that one?
Yeah, that will take a while. Yeah, let's do that. Thank you, Scott. Sorry, Monica.
You're fine. I'll just start off with the Board of Health informational item. The Board of Health met. We actually did have a special Board of Health meeting last week. For those of you who are relatively new to the board, in October, the Board of Health went forward with a readiness assessment for a cure violence program. The assessment was completed, and we had a special board meeting to actually review the results. From the results, the board met last night and actually moved forward with looking to push out a request for proposals or an RFP to start focusing on the first catchment area, which would be the East Bluff location in the city of Peoria. Our initial funding source will be the City of Peoria grant funds that we've already received to start that process. In addition, we are still moving out of our building, slowly but surely. Our last group will be moving out next week. And that is our WIC department and our dental department. So our dental, because we are utilizing equipment that we currently have, our dental clinic will be out of commission for about a week and a half. More than happy to answer any questions unrelated to the Health and Human Service campus.
Any questions for Monica? All right, thank you. Next, care and treatment. Is nothing? All right. EMA, Jason.
All right, good afternoon. So I believe you've got my monthly report, and as you'll see, things are beginning to pick back up for us in EMA. After the first of the year, many of our standard meetings with our community partners to just continue preparing for what the next event or incident we may deal with as a community and county. In the training side, we haven't had much recently, but I would like to put in a plug for, we've got a seniors officials workshop coming up in April. I think I've shared information with you a couple times on that. I'm just really encouraging individuals to take that opportunity to participate in it. Had some conversations with some of my colleagues this morning in the emergency management field, and I think that many of our communities are going through what we in emergency management like to call COVID pandemic fatigue, where after dealing with an emergency for such a long period of time, you know, a lot of people are starting to step back, and so we're struggling to keep people engaged with the emergency management, particularly after the pandemic. We recognize as emergency managers that there's a lot of priorities that many of our agencies, many of our appointed elected officials have, but we just like to encourage that emergency management is an important part of that. Was having some discussions, you know, we were talking about our response to COVID-19, and as a community, many of us felt like our response was, you know, we thought we were fairly successful in how we responded to the pandemic, but that wasn't as a result of just we were lucky. There had been a lot of hard work put in for 20 plus years prior to the pandemic with many of our community partners in putting things in place so that when we did finally deal with an incident, we were able to move forward. So if you have an opportunity to participate in that senior officials workshop, we'd really recommend it. I think it gives an opportunity for you to not only see what emergency management does for us in the community, but just as importantly, when they leave, they'll leave some suggestions with us on what we can be doing better as a community to ensure that you know, it's not if, but when we deal with an incident. And so just encourage people to participate in that. Exercise-wise, we will be participating. The airport has an annual exercise that they require to do a full scale every 3 years. That's scheduled for in April, so we'll be participating with the 182nd Airlift in the airport. And other than that, we continue to manage the grants that we receive as both the Health Department and Emergency Management Agency, and continue to provide outreach to the public, whether or not it be an article in a local periodical or a newspaper, or participation in, I think last week or a week before, we participated in the senior workshop with some members of the East Bluff and that community. So always just encouraging not only community partners and agencies to be prepared, but individuals and families. The more prepared we are as individuals and families, the more resilient we will be as a community when that next event happens. So, sir?
Thank you. And that training on the April 5th, you have to register for that, correct?
That's correct. Yeah, it's registration. You have to register through TEACS, which is Texas A&M, their extension office. They'll be sending a representative up here, and the registration's through their website. So.
And it'll be at the Peoria Fire Academy?
That's correct, at the Peoria Fire Training Academy. Yep. And it's scheduled for 6 hours. All of the training I've been through, they do not train to a 6-hour time period, so they're not going to put us in a room and say, okay, we've taught you everything, or we've talked about everything, now we'll just sit. Once they've accomplished their goals of sharing what they want, then they'll conclude. So if sometimes it's 6 hours, and sometimes I've been at some that go a little longer, simply because it provides good dialogue, and we begin to make some progress moving forward on some things. So.
Okay. Thank you.
Thank you, sir.
Yeah, any questions? Oh, okay, Ms. Duncan?
You mentioned the airlift practice at the airport.
Yes, ma'am.
When is that again?
Gretchen, did he
I-
give us the date?
I
The
thought you mentioned
22nd of
April.
20th is the Saturday, April 20th.
Saturday, April 20th, then, yeah.
Second, whatever the Saturday is.
Oh, okay. I'm sorry.
It'll be a full-scale exercise. I think it's scheduled from about 8 in the morning until noon. And it should include, the primary goal of this exercise will be to work through some issues with transport of individuals from an incident at the airport to healthcare agencies or to treatment facilities throughout the community.
And you must be registered through TEAC for that?
No, that, if you're interested in participating or viewing that, you can just reach out directly to me.
see.
Yeah, the senior officials workshop registration, but if you're interested in the exercise, you can just reach out to me at the
Okay.
EMA, and I can give you we've just initiated the planning. The 182nd Airlift Wing Chief Otto is the lead exercise planner, so I can get you more information
Yes.
on that.
Thank you.
You're welcome.
Thank you.
All right, thanks, Rob.
Okay, next is the Regional Office of Education.
Good afternoon, everyone. Shout out to Jason since he's here this month. I want to say that in terms of schools, Jason he embodies what an EMA is supposed to be in networking people and connecting them. All of my superintendents in Peoria County know him by name. They know what they can get from him. They know what information. So if it's weather related, school safety, COVID, all of it, they got to know Jason very, very well. So I appreciate the work that he does because it's a great asset to our schools in Peoria County. Just a few things this month. I had my first leadership team meeting at the new Peoria Regional Learning Center at the Franciscan Recreation Complex last night. It was fabulous. We did little mini tours. We will be scheduling a open house. We don't know what we're going to call it. Grand opening, ribbon cutting, don't know. We will do that, we hope, in early March, and you will all be invited. All right, 2 big events that are coming. Believe it or not, it is almost time for the GMB Spring Celebration, Arts and Education Spring Celebration at the courthouse. The reason I'm bringing that to your attention now is we are currently recruiting sponsors. So if you want to sponsor your child's school or the school in your neighborhood or county board region for when they come and perform on the courthouse grounds, that is $140 a day, sponsors the day, and we put your name out there and give you shout outs from the microphone, and we will turn the microphone over to you if there's a little kid in the audience that you want to embarrass. I always love doing that when my kids came down. So that is coming fast and furious. Kickoff day will be April 11th. Also, I want to bring to your attention that in February 16th to be specific, we will be giving out the Lincoln Award to the seniors in Peoria County that embody the characteristics of Abraham Lincoln. So why does that happen here? You know the statue we have here in the corner of the courthouse grounds? If you don't know that story, when I was a kindergarten teacher, I collected pennies in my classroom. It happened all over Peoria County, and that is how money was raised to build that statue. We got so many pennies from those kids. They loved that activity, by the way. We had money left over. From the money left over from that statue on these grounds, we've been hosting the Lincoln Dinner since 2001. And these kids are spectacular. We don't ask for their valedictorian. We ask who embodies the traits of Abraham Lincoln. We would love for you to join us that night. I will send you more information, but I'm specifically bringing it to your attention because there is a grown-up award, a community member, that's a better way to say it. A community member is given the Jim Cummings Leadership Award that also embodies the traits of Abraham Lincoln. And this year we're going to award that to former Sheriff Brian Asbell. So I will give you that invitation and share that out if you would like to join us. All I'll say is this. Every year it's like, oh, we have to plan that and we got to send everything out. And you go to the event and it gives you absolute hope for the future. Because you hear all the drama in the news about what other grown-ups are doing in various elected offices, and then you hear what these kids are doing, it will reinvigorate your hope in humanity. Last thing, the Wraparound Center. I wanted to let you know, are you all familiar with the Wraparound Center? It is a fully comprehensive social services agency endeavor at Tree Win. It is a side office in Tree Win where families can get the support that they need. So with the new dollars that I received for truancy this year, we have an office at the Wraparound Center now that we staff with our social worker to try to support families with greater needs. And if you're wondering about those greater needs, I attended 3 meetings in the last 2 weeks. My truancy workers had their staff meeting. I went to the Peoria Public Schools Foundation board meeting. I'm on their board. And I talked with Christy Hubbard, who's married to Devereaux Hubbard. She works for me a little bit for Preschool for All, and as you know, he's pastor of St. Paul Baptist Church. Families are calling every single day for help with their water bill, their electric bill, or uniforms for kids. The need has never been greater, and when our truancy officers are knocking on doors, we're finding things that just even 5 years ago, it is serious. And it's all over the county. It's not just a Peoria Public Schools thing. So I'm just bringing that to your attention because I was like 3 meetings in 2 weeks, and I'm hearing this. The foundation was asked to pay someone's $400 water bill so that their water wasn't shut off and the kids could stay clean. So I just wanted to bring that to your attention since I had heard that.
Thank you. Any questions? Okay, thank you very much. Becca's jumping up so I don't forget her this time. Next we have sustainability and resource.
Yes, good afternoon, thank you. I just have a few things to call out from the agenda brief that you received. In terms of collections, we do have a date for our annual Household Hazardous Waste Collection event. Again, we're a partner agency with the IEPA, so we, just because of the size of our community and then also the amount of hazardous waste we collect, and that date is June 10th. So I will be looking for volunteers for that. It's mostly just traffic management. Under unincorporated townships collections, Limestone Township has moved to referendum, which is in the agenda packet, but they decided on on language on January 10th, so that is moving forward for the spring ballot, and they'll be looking for combined waste service for their unincorporated residents of Limestone Township. Holiday light collection, we set a record this year thanks to some help from Nick in communications. We collected 1,179 pounds of string lights this year, so it was a new record. Previously it had been like 500 or 600 pounds, so we doubled it. I didn't know there were that many left out there. I'm glad to hear it. The landfill budget was presented. I'm skipping forward to landfill committee. It was presented this month, so that should come forward to you next month for resolution and your approval as well. And then under sustainability updates, the natural gas public sector incentive that we received from Ameren at the end of last year, that is being installed, I guess yesterday or today. So that will be wrapped up, and that was the the one that they paid the entire $92,000 for. So that is what I have, unless there are questions for me.
Is the household hazardous waste going to be at Expo again?
At this point, yes.
Okay.
Yes, unless we find a better location, that it'll be there again.
And that was by appointment, correct?
It is by appointment, and I'll send out all that information. Most people register online, but some people do call in. Last time, I think we had about 600 households. Previously, we've had about 800.
Any questions? Yes, Steve.
The limestone land for waste collection, I think it's a good initiative. Can you give an update on some of the other townships that were in that discussion? I see Limestone's moving ahead, but do we have I think there was an effort to combine and kind of leverage combined townships?
There was, and no other townships have moved forward to resolution yet, or to referendum yet. A number of communities did participate in the survey. Medina Township, actually, who wasn't initially one of the townships that was present, had the second largest response to the survey. So that information, all of the survey results have been shared with township superintendents, but no one else has moved forward yet. But there's still hope, I suppose.
Brian?
Is there any way you could send me a memo as to what Limestone Township is doing? Because I get a lot of calls from my constituents who are concerned about their garbage rates going up. So.
Absolutely.
Okay. I mean, I could have you explain it now, but I know there's
Yeah.
a lot of people here that
Sure.
want to talk. So, and the rest of you probably already know. So.
Yes, Nate.
Just a question that spurred on by the talk of trash collection. There was an email sent to us from the website that talked about someone complaining about their trash rates. And so what is the protocol with these emails and how are they being handled? Or is that just for our information, or we're supposed to do something with them?
Want to answer, Scott?
So rates within the city of Peoria are set by a franchise agreement between the city of Peoria and the current hauler, which is GFL. The county has no role in that, so it's more of an informational perspective. In the unincorporated areas, and other municipalities have similar arrangements with the exception of Bartonville. Bartonville is much more like the unincorporated areas where you as the individual citizen have to arrange for your collection. All of those, though, are based on, many of those rates, though, are also based on the contract that the City County Landfill Committee has with Waste Management to operate Landfill 2, which is almost a 30-year-old contract, and that has in it annual increases in the gate rate, so the rate that a waste hauler pays per pound or per ton when a garbage truck goes to the landfill. Those numbers are locked in. There's Waste Management is less than 2 years probably away from closing landfill 2 because it'll be full. So there's no incentive for them whatsoever to even come to the table to talk about rate changes. When landfill 3 opens, which the contractual operator is GFL, that landfill operating agreement will actually result, or should result, in price decreases for consumers based on what the gate rate is going to be.
That's good information. In more general terms, and maybe this isn't the right place to ask the question, but when we get the emails from the website, what is the protocol for those emails?
I think that depends on the individual board member. I typically look and I make sure to respond if that person is within my district. If it's not, you can reach out to the
Okay, thank you.
the other board members. Yeah.
I was actually pulling that email up as we were having this discussion. This person is in rural Trevoli and is stating that her trash pickup has gone up from 80 to 150 a billing cycle. With rural Trevoli, what is their garbage pickup? Is that an agreement
that is between the property owner and the hauler?
Okay, so they need to negotiate that Okay.
That's correct.
Or look for a different service.
Or look for a different hauler.
Yes, Ms. Daly.
And also, perhaps a lesser-known thing is the complaints that I've taken about a different waste hauler than GFL who has a contract with people in the city of Peoria, which I think there's a lack of understanding that there are people that can do their own private contracts, and they may be with Waste Management, even though Waste Management no longer has the city contract.
Okay, thank you. Yeah, Brad.
I was just going to say that if any of you are on Facebook, the Princeville families had quite a discussion about this about 3 weeks ago, and a lot of them found much cheaper rates. And I don't necessarily advocate going outside the area because, you know, I've been a stickler about using our own small business people, but from this company in Kiwanee. So if you have access to Facebook and Princeville families, if you live outside the city, there's some other alternatives.
Thank you. I'm going to jump over Triad real quick. Is there anybody here from the Center for Prevention of Abuse? All right. So we'll get an update on the long-term care ombudsman program.
Good afternoon. I'm Kevin Nolan. I'm a Chief Operating Officer at the center. Just wanted to give you an update on the program. So we finished our first year of partnership, so we're so appreciative of that. Finishing out the first year, we educated 224 family members and residents about their rights and facilities. We closed 99 cases where we found residents' rights were violated in those Peoria County facilities. We attended 104 council meetings to provide education and support to those resident councils at those facilities. We educated 103 facility staff about ensuring that residents' rights are being adhered to in those facilities. We provided 46 referrals to programs outside of those facilities to provide assistance to residents, and we conducted 344 routine visits in facilities to make sure we kept an eye that IDPH regulations were being adhered to in those facilities and to be available to residents in there who feel that their rights have been violated. Some of the trends that we were seeing in the last quarter in these facilities is an increase in falls in those facilities. So we have worked with the administration and staff of those facilities to make sure that those hallways remain clear from carts and clutter and things of that nature, but also to provide some education and guidance to those facility staff about lowering the bed height for those residents that are at risk of falling out of bed and having injuries as a result. Some of the successes that we've seen in the last quarter, one of them in particular is that we had a male that was living in one of the facilities who had two major complaints. One was being that, you know, all these residents have call lights to get help or to provide assistance, and those are supposed to be responded to timely. Another complaint he had is that he didn't have a wheelchair that was working. So one of our ombudsmen went to the facility to talk to the individual and certainly did confirm that they weren't responding to the call lights promptly. So that that ombudsman worked with the administrator at the facility, who then had an all-staff meeting and provided training to his staff there to make sure that they are promptly responding to those calls. In regards to the other complaint that the resident had, which was, in essence, he was a veteran, and he wasn't getting his medication paid through the VA, nor equipment that he would have been eligible for. So our ombudsman worked with the local Department of Veteran Affairs, actually had a representative from that department come to the facility to meet with the resident, and found out, yes, he indeed was eligible for those services, got the medication that the resident needed, and actually got a new wheelchair for the resident as well. So a great success.
And for the new members, last year the county entered into a partnership with the Center for Prevention of Abuse, and the grant that we provided them will cover an ombudsman, which is an advocate for seniors who are in long-term care facilities, and they make sure that they register complaints with them, make sure that their voices are being heard, and so this person or this position only serves residents of Peoria County. Does anybody have any questions for Kevin? Thank you very much.
Thank you.
And our last informational item is from Triad. We got Mike Bierce here, the president of the Peoria County Triad.
Thank you very much. I had some handouts here. Anyone who did not get one, I have some extras, so feel free. Sir? Since my last update on October 3 of 22, I continue to work with Carver Center, Peoria Housing Authority, and Neighborhood House, as well as others. Carver Center and Neighborhood House are working to form senior-based social groups from the local food pantry patrons, and Peoria Housing Authority at the Sterling Towers property is having their very first senior residents meeting Thursday of this week. And we're bringing in guest speakers from the Peoria Police Department and from Heartland Health. This was by their request. They want to get to know people out there who are charged with helping them, servicing them, and this is the kind of a forum that we encourage everywhere that we go. East Bluff Community Center, a focal point for the Cure Violence program, continues to grow its seniors and neighbors monthly meeting participation. We started out 6 months ago with 3 people. Now we routinely have about 18. I heard that this last meeting we only had about a dozen, but that's okay. It continues to grow. The speakers were the, excuse me, the Peoria Fire Department and Peoria County EMS. And both of them were talking about winter safety and smoke detectors availability. Limestone Township has a very successful monthly senior forum, and we're using that as a model for all the townships moving into 2023. We are also planning for quarterly small venue senior fairs in diverse locations, spreading it out over zip codes to pilot interest in senior projects throughout the county. We will also be working with OSF faith-based nurses, and there are about 34 of those nurses spread out over various kinds of faith-based institutions throughout the county. So we're working with those folks to start a well-checked phone call program so that we can get referrals to those churches, etc., with lists of seniors who would like to be contacted on a weekly basis, just to make sure that we don't have EMS walk in on someone who's been dead for 3 weeks. These are things that are avoidable. We just have to put programs together to do it. Our initiatives are poised to be very successful. In fact, Tazewell County Sheriff's Department reached out to us 2 months ago for assistance in restarting their triad. So they're using some of our models in order to move forward. However, success also means that funding and strategic relationships need constant attention. Last year's Peoria County Board Health Committee funding of $1,000 was used to purchase more of these files of life. These forms contain the seniors' medical and emergency contact information, so first responders can get immediate answers to initiate care during a call. On behalf of the Peoria County Triad and county seniors, we thank you for that funding. I look forward to working with the committee and individual committee members to bring Peoria County Triad initiatives to your districts and some of the folks that live around you. So feel free to reach out with any ideas that you might have so that we can get to everywhere in the county. Any questions?
Does anybody have any questions for Mike? Yes, Betty.
Thank you.
One question.
Yes. I have a comment. First of all, I'd like to thank you for your presentation, and then to let you know, and the rest of the committee, that those files of life
Yes.
that you handed to me, and I ran out, and you patiently were able to get me more of them because I had people, members of my church and others who were asking for those and needed those for that critical information for the same reason that you stated, the post on the refrigerator in case emergencies came up. So I just wanted to say thank you, and thank you, Rob, that to bring them on so that we can even have that. So that was very good, very good.
Thank you.
Thank you.
Yes, Steve.
I guess I have maybe a related question under your kind of welfare resources for seniors. Are you hearing any common themes of financial challenges and struggles? We heard a little bit from Beth on some of that for our families in general, but in seniors, any themes there about not utility bills, things they're challenged with? I know it's maybe not directly in your scope, but you may hear that.
Yeah, it's not directly in the scope, but in the course of discussion, it's always kind of pervasive throughout the discussions. And so consequently, when we bring the fire department in and they talk about free smoke detectors and putting them in homes, we're finally making headway with Peoria Housing Authority's Section 8 group. And of course, with the Section 8 group, the fire department can in fact press to make that a legal issue. But in the meantime, rather than wait for legal resolve of getting operating smoke detectors in rental housing, the fire department is willing to go in and rectify the situation while the legalities are taken care of. So we hear those kinds of things fairly frequently. And I think generally, especially on the East Bluff, where we're working with seniors raising grandkids in several cases, those, it makes you want to cry sometimes when you hear some of these seniors talking about everything they're trying to do that their kids have kind of left their kids with them, and there's not a lot that we can bring to the table other than, because we have on the back of the sheets that I handed out, Prairie State Legal. I think they're on there. Yeah. Prairie State Legal often will consult with individuals that reach out to us so that we can at least try to get them some immediate help. Don't know if that really answers the question, but at the moment, that's about the best we can do.
Yep. Yes, Phil.
You mentioned fire detectors. How about carbon dioxide detectors and so forth? Would that be included as well?
They're included, I think.
To the best of my knowledge, it's not included, but I have to tell you, I didn't ask. So I don't know the answer to that. That's a good point. I will ask that question.
Thank you. I do know, just from the year that I've served and mostly listened to meetings, I haven't been able to show up to one yet in person, but just the excitement in the room and the amount of participation you're getting from the members has greatly increased. And the last meeting that I was in on, they were talking about these quarterly senior fairs and the amount of enthusiasm that picked up, and of the members, and the members willing to work on this. I think it's going to provide a great opportunity for the seniors in the entire county. And that's what I appreciate, is that it's not just a Peoria City based organization, that it wants to encompass the entire county. So I appreciate that.
Thanks. Yeah, I totally lost control of the last meeting.
It's true.
Everybody was talking. It was great.
If you want to stay there for just a second, I'm going to transition right into our committee action item that we have on here, and that is to renew the grant that we had given last year to Triad. And last year, I know we had given $1,000 just to help get them going, and now that they're they have the traction going. They used the $1,000 that we gave them wisely for that. We're asking that we up it to 2,500 to really help give them the kind of the footing that they need to continue the forward momentum. So I'm just looking for a consensus from the committee to approve that $2,500 grant to them. Do we need to? Since it's just a consensus, we don't really need to motion it. Yes.
This is I'm in full support. That's a very little amount of money and a little investment on our part.
Little to us, but big to them.
Yes, but for a great impact, right?
Right.
But my question was to Scott, I mean, how often do we, since most of these come under your purview, do we do grants like this to other organizations as well?
No, we do not.
Mr. Dillon.
Chairman, could maybe the group explain what they intend to do with the $2,500?
Sure.
Or what the need of for exactly 2,500 is?
Sure. Mike, do you want to?
Sure. Okay. I will tell you that based on, well, first of all, these file of life things, they cost a little over $1 each. And so one of the things that we're trying to accomplish is the inserts that are inside, rather than folks, which I know has happened in the past, rather than folks throwing the whole thing away, we can just give them the new paper inserts to update and then put back in there. If we just do that, that will help cut down on the initial expense. Secondly, the other things that we have for expenses are, to be quite frank, we have to try to get the word out to existing organizations, townships, et cetera, to make sure that they understand who we are and what we do. And the website, yeah, I can tell you. Last year, the website application, I paid for out of my pocket. That was $360 because it was necessary and worthwhile. So we have a lot of what I would call small expenses, you know, the constant ding against a budget. Those kinds of things, providing coffee to small groups, to spend $25 on a couple of those jugs of coffee. It's not a lot of money, but over the course of a year, if we can have folks coming together over a cup of coffee, it's well worth the expense.
And the senior fairs also.
Yeah, that's not even counting the senior fairs. We're going to try to hold 4 of those and maybe one larger extra one with Jehan Gordon Booth this year. So those kinds of things, just, you know, you have to pay for facility and people to actually do the physical movement of tables and chairs and that kind of thing. So $2,500 over the course of 12 months, it's greatly needed and very much appreciated.
Thank you. Any other questions? Yes.
So Mike, does the group have like a total budget for what they do in a year and what other of the partners give grants to the group?
SEFTU is the only member that has provided a grant, and I will tell you, over the past 3 years that I've participated, the dollars that have come in, excuse me, the dollars that have come in have been almost zero because there was so little activity post-COVID. Prior to that, prior to my moving down here from the Chicago triad, DuPage County triad, we had budgets that were 15 to 20,000 every year. And so when I came down here and I found out, you know, that they had like 1,000 in the bank, I was dumbfounded. And so consequently, the last 2 years, even excluding COVID, my job has just simply been to put some footing underneath everybody so that we can move forward. What's the money to be used for? I think budget-wise, what they have been doing is just like someone with limited income looking at their checkbook and going, we need to buy groceries, how much do we have? That's been our method up to now. And so we are, quite frankly, for 2023, with having the mini health fairs, charging other service providers and vendors $25 or $35 to have a presence at those things. I'm hoping that we will begin to start bringing in some revenue from these things. That's all that I can tell you with all honesty at the moment. Everything else is just wish list.
Any other questions? Okay, I guess I'm just looking for a consensus. Is everybody okay with the $2,500 grant for this year? Any opposed? Okay, great. Thank you. Thank you, Mike. Finally, we are at the Health and Human Services Campus Update.
All right.
We might go over a little bit, Jennifer. Sorry.
Thank you, Mr. Chairman. We have Dan and Josh from River City and Ellen and Alicia from Farnsworth here today. We wanted to spend the first part of the conversation walking through a handout that we'll give to you from River City that kind of focuses on process, finances, and remaining schedule. And then as discussion and time allow, Ellen and Alicia have got the large format of the floor plans that you requested that we can hand out and try and answer any questions related to those. So I'd like to give the floor to Josh and Dan from River City for them to walk through the materials that they've prepared.
Scott, can we make a request to get this electronically as well? Because I can't make this go bigger.
Yes.
Thank you.
Okay. Good afternoon, everyone. I'm Dan Hopper with River City Construction. I'm a construction director. With me is Josh Sanders, Executive Vice President of New Work and Pursuits with River City, and then Ellen Spencer, Senior Project Architect for Farnsworth Group. So appreciate the time today. Essentially what we wanted to do is just talk through where we're at as far as value engineering and over the past several months in far as the process itself, and then some of the steps specifically with the HHS project to get us to the plans that Farnsworth brought today. So early on, after the site location was selected and the new building approach was selected as well, that Farnsworth went to work as far as starting their initial programming and to develop the initial plans for the project. And Ellen can talk a little bit about that process on their end of it.
Thanks, Dan. So as most of you know, we did the subcommittee meetings to talk about the services and the user groups and understand the demographics of those different departments residing at the building. From there, we were able to develop the program, so that gives us the spaces that are needed to actually function properly. What are their sizes? How many of them exist? What are the adjacencies? So which spaces need to be next to each other? What can be on the first floor versus the second? And how the public versus private, so the patients versus the staff, will reside in the building and function throughout the space. That then ultimately gave us this initial design of the two separate buildings. So the corner, originally we were thinking would be its own standalone building, and then the main building would house the health department and the regional office of education. So once we kind of developed all of the footprint area, then of course you put a shell around it and design the architecture to give us a full building overall.
So with this approach, that's turned over to River City, and then we begin our cost evaluation. So when we start those evaluations, we look at the current market trends, we look at input from subcontractors, suppliers, we look at past data within the last couple of years on project costs to develop this initial project value. So initially, the project value with the two separate buildings came in at about $28 million, just starting the overall review. So we obviously are looking to get below 20 million, was a target estimate of the project. So we go into what we term value engineering. We get asked what value engineering is. The committee may know, but just hit the highlights of what that actually entails. So value engineering is basically a detailed analysis to meet the program needs in the most economical way, evaluating constructability, means and methods, products and material, and then just evaluation of building components and systems that will yield competitive bids. So essentially, we take the information we have from the original design and we start to look at opportunities to be able to save money without impacting the quality, the operations of the departments and the services they're providing, and do what we can as far as looking at just long-term materials that are gonna stand the test of time as best possible. So this is an approach that's typical in most integrated building design methods. So the overall value engineering, it's ongoing throughout the process. We are, Farnsworth and River City are constantly looking at anything and everything as far as being able to provide a good product and a quality product and meet the needs of the building and also just time-wise and make sure that anything that's selected as far as materials, equipment can meet our overall schedule. So the first round, after we realized the 28 million, we went to work right away with Farnsworth and came up with the best approach to knock off. We're looking at $8 million is to consolidate the two buildings. So that was our first round of value engineering. By doing so and consolidating these buildings, we were able to realize about $5 million in savings. And with that, some of those reductions were based on obviously roof and overall footprint, reductions, shared utilities, shared generators, better use of the overall site. So that was a big impact to help get us towards our goal of below the 20 million. Since we hadn't reached our overall budget, we went ahead and went through a second round of VE exercises. So we went through and we have quite a list, and I think Scott prepared that list that you may have seen a few weeks back. But some of the highlights consolidating were reducing the number of medical and dental exam rooms without obviously jeopardizing partnerships, reducing size in offices and space, not necessarily to a complete reduction, but obviously something that still can conduct normal operations, obviously. So reducing size of sub-waiting and intake areas, so on and so forth, reducing the two-story spline design element by more than 50%, some other eliminations of the green roof, converting the partial basement to crawl space and reducing the size. So through this second round of value engineering, we were able to realize another $1.2 million in savings off the project. So right now, we're currently in our third round of value engineering, which is right now undergoing a ongoing conversation with River City and Farnsworth to see what else we can switch out as far as materials or eliminate where possible. So the mechanical, electrical, and plumbing systems, we're working with Farnsworth to get those initial designs, to get those out with our partner subcontractors, to multiple subcontractors to evaluate what's available as far as equipment, what manufacturers are available to give us the best price on some of these items, and anything we can do to help reduce that overall cost. We're evaluating structural systems, which includes foundation systems. There's talk that we may have to use some ram aggregate piers or maybe a deeper foundation or undercut the building. So we're evaluating what those costs are and what the best value is. Eliminating the crawl space. There's opportunity to eliminate the crawl space. We're feeding med gas and some other utilities below slab, but is that really needed? Can we do it? Can we feed all those utilities above overhead to be able to still operate and for long-term, needs of the building? Will that meet our needs and lower the price of the building? Reducing clear story in the second floor subweighting, an item we're looking at. And then there's some side items. We're using asphalt millings, on-site crushing and backfill of some of the existing materials on site, utilizing light-duty pavement where possible without in the way of direct traffic from trash equipment. And then also looking at various bid alternates. So throughout this process, we'll develop a list of alternate finishes inside the building. So the bidders will have a base bid that may contain certain finishes in the building, and then we'll have multiple alternates to either add or remove those. And then once the final budget numbers come in, we're able to evaluate those and to be able to make selections to still target that below 20 million. A couple other items, reduction in glazing, eliminating sunshades, and so like we said, we're constantly evaluating these opportunities. And as of right now, we're still working through this list to see where that reduction gets us to as far as our target budget for the project, but we're continuing the process. So Josh will talk a little bit about just current market conditions in construction.
Sure, good afternoon. Felt this was good information to include to kind of talk through over the past couple of years with the volatile market and extreme material escalations, labor demand. It's good to kind of talk through how we establish initial budgets. Once Farnsworth was able to go through and put together an initial program to meet the needs, basically River City will take it from that point to put an initial cost in place for that concept. The way that we typically will do that, and is a market standard, is we will leverage past project information. So in a 2021, 2022 budget endeavor, we're looking at projects that are underway or have been completed prior to, so 2019, 2020 information. We take that information and we use different industry escalators. E&R BCI index is one that we use quite often as an industry standard. And at this point in time, you can see that 2019, 2020, where we're fairly normal percentages of increase from year to year. Averages generally are 2, 3, 4% maybe. Going into 2021, we were seeing for overall construction average 13.1, and into 2022 9.4, and that's on overall construction. We kind of highlighted a few of the averages on record material cost increases as well. Again, 2019, 2022, which would have been the basis for a lot of projects, not necessarily just this project, but a lot of projects that have been in budget over the past year or two have been seeing these same types of increases because of what was actually experienced in 21 and 22. So again, it's just a good piece of information to have in front of us as we're trying to go back and look at the design that was created to meet the need and put the budget in place. So, and if you would like to go to the next slide. So essentially that previous slide was just kind of the facts that are out there that were provided that we keep tabs on regularly. Here are just some of our own experiences that we're either currently going through or have been through. The first few are just construction manager at risk, integrated project delivery. Again, you can see I just noted that the percent over budget that these were initially. The first three were delivered the same as this project is. They were fairly substantially percentage over the initial target through the same process of value engineering and making the right design decisions for the space. We've been able to pull a lot of these very close to the original budgets. The last three that are on there were traditional design bid build projects, and again, I've noted the percentages for those projects, how far over budget they are. The disadvantage on those projects really comes back to the time frame. The owners of those projects aren't seeing how far over budget their projects are until post bid. In integrated product delivery, we're working together to get a project within budget in that design phase. So we're very much, in my opinion, delivering the project in the correct way. There are some advantages of that. We're leveraging that day to day. Again, this is just information that's out there that whether it's personal experiences or just industry information. So I think.
So, tried to give you just kind of a background of the past several months of this undertaking we've had with some of these market conditions post-COVID, which have been, at least in my lifetime, very unprecedented. So, just looking ahead as far as schedule and current status. So, looking at budget confirmation, guaranteed maximum price set after final VE efforts in early February. So once again, during this next several weeks or few weeks, we're going to be working with Farnsworth to identify any more opportunities for cost savings. Final design in drawings will be available in early March, and then it'll be roughly about a 4-week bid cycle of getting the bid information out through Jim Smith through procurement and get that the bids reviewed and then back in. So by end of March, obviously we're looking for the maximum number of bidders for the most competitive results as possible. So like we said, we're working with Jim Smith. We're working as we separate these bid packages. You may have packages such as building concrete, glazing, so all these individual prime contracts. So we'll look to provide the most attractive for each trade that we're used to dealing with here to be able to get most competitive numbers we can and as many as possible. So also we're going to be working with minority outreach efforts. We're going to have a separate meeting, but we're going to have 2 pre-bids. We're going to have a reach out pre-bid meeting with diversified women-owned minorities. Our managing partner, GIFSCO, is a minority-owned contractor. They're going to be reaching out to through their channels and their publications to increase our outreach to try to get as many of those bidders involved with the project and asking questions and hopefully submitting bids for us as well. So I think that's all we had today. Just open it up. Any questions for us? Anything you guys need?
We can run through questions before we go over the floor plan real quick. So, any questions for River City? Yes, Member Daly.
So are you saying at this point, as you're doing the third round of value engineering, that the 21.8 million includes finishes and furnishings?
That would be correct. Yeah, that would be hard construction costs and soft costs, which include design fees, furniture, yeah, all of our fees associated with, yes.
Thank you.
Any other questions? Yes, Steve.
And just for confirmation, demolition cost and all that are part of that total package, right?
Correct.
A demolition of the Sheridan Sheridan facility, but not the Gift Avenue facility.
That would be accurate, yep.
Okay.
Yes, Brian.
Is it possible that if you took a building, and function is the most important thing, you know, for all of us, is so that people can have their services and in a private manner. You don't want them to be able to hear what they're saying from the next room because it's built so shadowy. But I mean, isn't it possible that you can just line up all the hallways and put rooms on each side and come up with a building at at $12 or $14 million? Is that even feasible? Or, I mean, we don't need a Taj Mahal. We just need to provide the services for the people in Peoria County.
Sure.
And I think some of the designated spaces may have some limitations on what you can do square footage-wise. The other amenities of the building have minimal square footage requirements. So I think that's been part of the value engineering process, is not only of cost savings, but how do you make the most efficient design for the space? So I think that we're on an ongoing basis working through that as well.
Yeah, I think Ellen might be able to talk more to it, but just as far as the overall programming and how we came up, and I think a lot of this is not only the current needs, but the future needs of the community as well.
And I will say, all of our exam rooms right now are on double-loaded corridors, and kind of like, it's like a ring road kind of theory, where the exam rooms are kind of in a circle with the staff spaces in the center. So a lot of the efficiencies in the floor plan have been incorporated, and then through the value engineering, keeping partnerships in mind, and then keeping the needs and the program from these mandated services in mind, we have worked with the department heads to reduce square footage as much as we possibly can without being detrimental. So providing this building for a $12 million price point, I mean, I'm sure we could build anything for $12 million, but it would not serve the need that you guys have, and it would not be able to incorporate all of those departments within this facility that's been requested of us.
Yeah, that's key. It would not facilitate all services for that size of a building.
Correct.
Jennifer first, and then back to Steve.
This question's for Scott, I suppose, kind of off of Brian's point. I heard Dan mention that we were looking to be under 20 million. Can you remind me again where we jumped from 16 to 20? Because I thought 16 was our initial discussion.
So the current sources are as follows. There's been 14 million appropriated out of ARPA, and another 250,000 appropriated out of the Solid Waste Management Fund. What is intended to be appropriated going forward is the health department has been building up their reserves for a number of years, and based on current performance and staying within the county board's financial policies for fund reserves there's at least $4.5 million, or about $4.5 million of reserves in the of the health department fund that do need to be appropriated, and then it was always intended on later on in the project. So either in this year or next year, there'd be a second $250,000 from the solid waste management fund. Add all of those things together, and we're at $19 million. So that's where we're at today, and then it's a function of and a policy decision for the board as to whether or not you would want to allocate some additional ARPA dollars should bids come in above that number.
So currently we have 19 million without having to do a budget amendment.
No, 4.5 from the health department fund reserves does need to be appropriated by the board. It's intended for the project, but it's not been appropriated yet.
Understood. Okay. So we're closing that gap. Yes, Steve.
And again, I've seen the original with the spine, and I like the spine from an architectural appearance and that, but, with the glass and the natural light. But, visually, that gives me concern that the cost of putting that second story spine glass, and I know you've shrunk it from full length to half length, and you've got some comments here reducing, but to me, that design puts cost in that architectural, it looks great, but functional, can we get daylight and natural light in better ways, more cost effective? I guess that's the visual challenge I have as a board member of, I want it to look nice and serve well, but I don't need it to, the architectural piece of it is a nice to have, but it's not necessary when we're over budget so far.
Sure.
Do you have any comments, Ellen?
Yeah, absolutely. So we definitely have reduced the clear story quite a bit. It has been a concept driver for most of the building, just because of the amount of first floor square footage that we have to accommodate. It does make for a very kind of dark core. So adding natural light to that center space, especially as that is the subwaiting for all of the patients and the visitors to get to their services. So we did look at this, knowing that we have gone through value engineering with River City, and at this point we have reduced it probably as far down as we possibly can through this third round. So we will be getting cost updates related to that. If we were to change the design at this point, it would drastically change the circulation flow of the building for that center area. And by changing the roof levels, we'd have to look at different flashing details. And so the point that we're at right now is probably a drastic change to the design, not just as it relates to money, but just we'd almost have to rethink the end result of it and go back to structure and rethink the support systems and mechanical and electrical and plumbing systems. And we're almost at that time where redesigning it and the time lost isn't valuable enough to offset the cost that we would save from eliminating it completely.
That's what I was trying to get an idea of, what the delta would be if you removed the spine and that design went to a different center design, which I understand you'd have to, it's a major redesign. It's not just changing one element because everything's built off of that.
Yes, exactly.
But are we looking at a $2 billion delta to go to a different center core design, or are you talking a $500,000 delta? What's, and I know I'm kind of asking you to guess, but
yeah,
you've done buildings, so you know some general where that falls.
We'd have to look at it for sure.
A number on that at this point in time, but it was something we can definitely evaluate how it impacts cost by eliminating that, and then maybe how that impacts design time and schedule as well.
Yeah.
So we can definitely go through that that study.
And then just in terms of trying to roll out, obviously the additional rounds of VE now that we're faced with now here during this post-COVID to be able to pull it back in. We'd like to get this finalizing on the streets and the opportunity versus just fearful that we don't necessarily know if the market's going to keep escalating, because it is escalating now. It just maybe had, based off that last slide Josh talked about, are we looking at another 6 or 8% if we over the next few months if we have to do a redesign and the costs associated with it and getting it back on the street. And we'd like to get it on the street. Obviously, right now is a good time to get it on the street as far as, early first quarter is a good time to get it out there where a lot of contractors after winter are looking for new projects to base it, So we feel we can get more competitive pricing at this point as well.
Brian?
Well, with the 8% interest rates, you might save a whole lot by waiting a year too. So I mean, I don't necessarily buy into the fact that it's going to go up 6 or 8% in the next few months. But as most of you know that, what'd you say? What was the question? Oh, the 8% is that's what people are paying for operating loans and things like that, and so that does affect the whole economy. I've come out and I'm kind of surprised that I've even said this, that I'll support a project at $7 million, which if you add the $4.5 million on with the health department, that's 11.5. And so I know it's not the tenor of the board right now, but I wish they would come back and just say that it's going to be 15 or 16 all in, design the building that way and let's make it work.
Jimmy?
Dan and the team, they touched on it, but I think it's important to note, though, too, when we talk about it and the team had these numbers, when we gave them the budget, I've always thought about, I know it's changed with what Monica was putting in, but we've been consistent at originally 14. Their numbers fluctuated, so you could say 16, 17. So when this process started, early 2001? 20?
More 21 than 1.
So that 14 million, I know the number's gone up quite a bit, but I think it need to be realistic even when they're trying to design backwards, that 14 million is worth another 4.2 of cost escalation. So what we said 14 million was really an 18.2 in today's costs for being there. So I know we have our hearts set on trying to get to this number of what we were trying to budget, but with the way the construction world has been the last couple of years, it's just not feasible unless you really design down what we want, and then what's the point of building that, because we're not paying for what we wanted. So this needs to be a building that is designed functionally, and I'm full in agreement, we don't need above and beyond things in the building, but functionally the structure has to be something that will serve the needs of the community for the next 60 to 100 years. And we might have to be prepared to pay for that. Fortunately, if we would have built this 3 years ago, we would have probably gotten a lot more building potentially. And this isn't even costing, I heard our breakers were in ComEd are 430 days out. And luckily for Ameren territory now, I think we're at 250 days out. I mean, that's part of the conversations of the supply chain is still a disaster in the industry. So I think we just need to be realistically expecting of when we keep talking about these numbers, the cost of what that number in today's dollars is not the same.
Thank you. Yeah, I agree. And, I appreciate what everybody has done as far as value engineering, because I'm seeing that number get pressed closer and closer and closer to reality in my mind. I mean, we're no longer at 28 million where we're thinking, well, we're going to come up with another $14 million. So I appreciate the work that everybody has been doing on this. Any other questions? Yes, Nate.
Just one comment. Obviously, the design criteria was done by a previous administration, but it would help me be able to make a decision. First off, if I had a plan that I had long enough arms to read, it would just so I can count the number of rooms, and then someone I don't need the answer to it now, but where is all that data at that decided we needed 16 exam rooms or whatever, just so I can say, yeah, that is what we need for 80 more years, or wow, someone's shooting for the moon. That would just help me be able to make a decision.
Sure. Well, we can help with the first part really easy, right? Because we have the large we have large floor plans that you can leave with. The second part, I'm sure Scott can
Yeah,
provide all
we have
the
a
information.
packet of materials that that the prior health committee and the board has seen. So we'll make sure you get that along with all the other new board members.
Any other questions before we move on real quick? All right, do you want to hand out the floor plans? Or
We can hand them out, so because it is very large, and so we wanted everybody to be able to see it. They are on 30 by 42 sheets, which are pretty large, and it is one floor plan per sheet. So what I might do is just have 2 stacks on this table, and those that want to take them can,
Okay.
if that is okay.
Sure. And could you just explain real quick? I know there was a question at our last meeting about there was concern of having the coroner's office in with the health department and making sure that somebody can't accidentally walk into the morgue.
Correct.
So what kind of design and security have we to make sure that
Incorporated?
that's not going to happen?
Yes. So all along, we were kind of anticipating that we would have 2 buildings. The coroner is a 24-hour facility and obviously has a slight different need than the rest. So we were thinking it was separate. Based on the presentation that you just saw, we need to consolidate it. With that, we still do have 2 entrances. There is a main building entrance, and then there is a kind of secondary coroner entrance. There is a public visitor aspect then for the coroner. There is a viewing room. It is very much tied to that vestibule, and they can't get any further. We've worked with the low voltage team, the sheriff, and the IT department to work through like card access. So it's controlling how you can get in and out of doors. That system can also be either like escorted with someone and then they would key fob in, or if it was just a public visitor, they wouldn't actually be able to get back further. And then based on the floor plan layout, which again you'll kind of see in the bigger versions, we do have a staff entrance at the back side that does link to the rest of the building, but that is actually not linked to, again, that secondary, or actually the main entrance for the public of the health department. So it is true back of house. We're trying to delineate throughout this entire facility the various levels of public versus private. And so we kind of have like 3 different stages where something is extremely public, something is semi-public, and then something is extremely private. So the coroner in that regard is basically a private entity, and then they have their front vestibule and what we're calling a viewing room as the public entrance. And then through the card reader access, it would help internal security with access to and from.
Steve.
And the coroner and I had a discussion last week on the topic of isolation and air handling systems between the 2 operations. So again, we don't want the air handling coming from the coroner's office to the dental office and such. So maybe you can address that. Give us some comfort level.
Yes. So since it is one building and part of the value engineering is to combine HVAC systems, so the offices for the coroner are on the 2nd floor with a lot of the offices for the other departments. We actually enjoyed that separation, so that way the staff does have a break between what they might be doing at an autopsy level versus what they might be doing at their desk. So for the safety and just the mentality of those working in this building, we thought the 2 levels would be appropriate. With that, the 2nd floor then, because it is basically just office space, is on the same rooftop units as the rest of the building, so it would still heat and cool like everything else, saving cost in that instance. The morgue, however, and the uses on the 1st floor that are related to maybe potential odors that we don't want throughout the system has its own isolated. It's a DOAS system for those that might know what that would be, but it's basically its own exhaust and then its own cooling for that space as well.
Is that a negative pressure system for safety and that of the people working in those situations?
Yes, and in addition to that being negative, we have 2 specific exam rooms on the health department side that are for TB, and those are also negative pressure as well to kind of isolate what could be happening in those exam rooms. Correct.
Jennifer?
Can we hear from our elected officials as to, how they feel these changes impact their needs?
Absolutely. Does anybody have anything to say?
I think the combination of the health department and the coroner's office is probably more Monica's worry, with me lingering into her area as opposed to the other way around. We currently share our building with the Child Advocacy Center, the CAC, and right now we're housing a portion of the health department as it is, where the public is actually walking into our building, using our bathrooms while they're getting their health records. So I don't see it being an issue specifically since we have a separate area. I think Ellen and I have spent an incredible amount of time going through our designs and reduction. Just so everybody knows, they took the private bathroom out of my office, so I don't get that anymore. I do think the lighting is important in our building because we do such dark things. We're in a dark area now, so I think it's beneficial. But the space, I think what we've reduced it down to meets the standards of caring for our public, which is what we're here for. I think the autopsy services that we're going to continue to provide regionally will meet the needs of our other neighboring counties, and the space that we have specifically designed for our law enforcement will also meet those needs on our investigations and our homicides. For example, we had a homicide case over the weekend. We had 4 law enforcement officers in our building. It is just such a necessity that we include in our building design plans, and I really credit Ellen and Farnsworth for what they've done to make those reductions down to what we can do to meet the public. So, and I'm happy to answer any questions too.
I think just a comment. One of the things, a huge plus is you'll be able to unload bodies now without the public seeing.
And that is a big deal to be able to pull into a garage and close the door and unload, particularly for the privacy of the decedent and really the safety of our staff as well. Because believe it or not, people follow us from the scene to the hospital, to our building. They wait outside, etc. So that extra added security with the doors closing, the key passes, the key fobs, and that is beneficial for all of us. And the privacy of our decedents.
And some of our new members, I know we're going to take a tour of your facility here in a week or so, but they'll be able to see that, you know, the refrigeration system that you have now, how you can't accommodate many bodies safely without it being a liability to our workers.
There are difficulties in with just the unloading and loading on our platform now is at an angle, about a 20-degree angle, to pull a cot out, which is obviously dangerous. The loading and unloading in our cooling system is a contraption, so like a freestanding cooler with shelving. So we have a row at the top that we can't even use. So we're very limited on our capacity as it is. So these types of things will reduce our risk for injury of our own employees. And Camille Coates, I want to say thank you too. She did tour my building covertly. I didn't know who she was when she did one of our tours, and then had 1,000 questions afterwards. So I welcome all the new board members to come through our office. I've seen some. I know Steve came in and whatnot, and Brian's been there as well. So I'd welcome all, and Linda too. Come into our office, take a walk through. I know when Farnsworth came in River City, they were like, like, we need to do something. We're surviving in our space and providing best practice to our community as it is. But I just look forward to what we can do moving forward. So,
thank you. Any questions? Any other comment? Yeah, sure.
I just want to put a comment on record that I'm an advocate to include the coroner's office in this because at the end of the day, we have a building over Gift Avenue that doesn't meet our needs, and we could put $2 to $3 million into improvements for a building that isn't designed to be a coroner's office. It's not designed for this. So I'm not interested in throwing good money after bad repairing Gift Avenue. I'll be the first to put that on the table. So Gift Avenue, leaving the coroner's office there, in my book's not an option because it's not a good result and not a good offering to our community and our taxpayers. So, on the record, I want the coroner's office, and we had that in our priorities. The challenge is, how do we do this cost effectively? And I think this is the right direction. We just need to figure out how to get where we need to be. Thank you.
Sure. One of the things I want to add to that, Steve, just give me 1 second here, Phil. Not only do we have myself, we have 6 other employees that operate out of our building. So I have a morgue coordinator who is in charge of everything morgue, a chief deputy, and then staff members that work under us. So have, right now they share office spaces and workspaces independently opposite their shifts, so they don't have any personal area for their own work areas as we stand. Of course, we're making that work, but back to my point with Ellen, we're not asking for anything above and beyond just having individual workspaces for our employees. So it's a minimalist design on our part. And I asked her when I came in here, what's our square foot allotment? And right now we're just over 7,100 square foot for our morgue area and our employee workstations, just for the information of the board what that square foot looks like. One of member Windish and I had a conversation earlier this week, and that was one of his questions that I wanted to answer for him. So,
Thank you for that.
Phil.
I was just going to comment that, Mr. Rucker, I totally agree with your comments and so forth, because I too have been through that. In fact, before we even started our project, we did a tour of the coroner's office. I was flabbergasted how this was close to a disaster out there because of several different things which I could list for you, and you people who have been, I'll say, viewers of the coroner's facility, you know what I'm talking about. I'm ashamed that the coroner operates in such a terrible situation.
Thank you, Phil.
I do have a bug guy that comes out and takes care of the roaches and stuff, so I'm okay, Phil.
And I'm all for fewer roofs to maintain. So we would get a new roof for multiple departments. Beth, do you have anything to add? Okay. And that's one thing I'm willing to set people, if you have additional questions or comments, I'm willing to set you up with whoever we need to make sure that you have all the information you need for this. So thank you, everybody. I appreciate it. Anybody have anything for public comment? Miscellaneous. I do have one thing for miscellaneous, and I've reached out to quite a few board members over the last couple of weeks, and I still have more people to reach out to, but I found that there is somewhat of a want to have additional representation of the board on the design committee. While we don't have an owner's rep, we thought that we would leverage some of the talents that we have on the board, and one of those is we have a board member who is in construction, and he has agreed to kind of serve on the design team, not really to make decisions, but just kind of oversight. So Terry has agreed to do that for us. We'll have a special health committee meeting before the next board meeting. He and Scott are going to kind of work on what the scope of that's going to look like, and we'll vote him onto that before the next board meeting so he can get started right away. All right, we're adjourned. Thank you.